Have you ever noticed how in life two people can react entirely differently to exactly the same event? Even if the event is difficult or traumatic or challenging, people's reactions are often extremely different. As a minor example, some drivers remain completely calm and unfazed when somebody pulls out dangerously in front of them, whereas others swear and toot their horn. The response may be different between different individuals, but in that case, and in all of these cases, the event is exactly the same. Cognitive behavioral therapy is about understanding what causes these different sorts of reactions and replacing thoughts and thus behavior with sensible, measured, proportionate responses and behavior. The premise to cognitive therapy is that your thoughts create your moods. This is in stark contrast to the thinking that things happen to you and they create your moods. Cognitive therapy teaches you to take control of your thinking and therefore ultimately your moods, no matter what happens in the external environment. The power is always in that moment between the stimulus and the response. You have stimulus, you have automatic thoughts that happen, and then you have response. It can also be applied to other areas of life, such as communication skills or procrastination, so it's a really useful thing in addition to its use in depression. An event happens to you and then thoughts pop into your head. I could do that, I should do that, perhaps I better not do that, that's going to go badly wrong, will they be thinking badly of me? We all react automatically, and we do so in so many different ways to the same event. And some of those reactions are measured and realistic, and they really help us when they are. And some are really not. And these get ingrained from a fairly young age, and yet retraining them is easier than you might think. The evidence for cognitive therapy's effectiveness is overwhelming. 50 to 75% of people who undergo it achieve remission from depression. That remission is also long-lasting and has a relatively low chance of relapse compared to many other therapies. That means that if you try cognitive therapy, it is much more likely than not that you will be able to achieve remission. Other forms of psychotherapy generally don't have this level of evidence to back up their effectiveness for depression specifically, or in many cases they don't have evidence at all for this use. Certain forms of therapy, in my opinion, I think might even actually be damaging. I've seen this to some people, around me. For example, I think digging up your past over and over again when that past has been traumatic is not always going to be helpful in overcoming a depressive episode. And indeed, that approach hasn't been shown in evidence to lead to an improved chance of recovery from depression. Now, that's not to say that other forms of therapy aren't useful in life in general. As a slightly off-the-wall example, it's not exactly therapy, but to this day I regularly get business and personal mentoring. I'm exploring thinking patterns in a specific part of my life in a structured way. It's one of the most useful things I've ever done, and so whilst it's not exactly therapy, it feels like it's very useful, and there's kind of a touch of overlap with that whole sort of genre of things. But for depression specifically, I definitely can recommend starting with cognitive therapy. It's very much about your thinking patterns in the here and now. It's present looking rather than looking at the past, which you can't change. No point waking up in the morning wishing for a better past. It can also be done relatively quickly, and because of the good evidence to support it and the speed and the efficacy of it, it's often referred to as the gold standard of therapies for depression, talking therapies for depression. It's been the best studied of them all, and it has the strongest evidence to show it's effective. Now, I've heard some misconceptions about cognitive therapy. The first is that it's somehow about rationalizing your responses to events rather than feeling differently about them. Somebody said to me, I think it'll help you to get out of bed in the morning and to tie your shoelaces, but it won't help you to feel truly whole. In my experience, nothing could be further from the truth. What I found was that over a period of time, my response to events changed, and then my automatic thoughts themselves shifted so that they started to reduce or change. And it started to stick to the extent that eventually many of those distorted thinking patterns that used to just pop into my head, they simply got fed up and they stopped bothering to show up there for work. It's not simply about helping you get out of bed in the morning. It is a way to profoundly change your experience of life in a way that will stay with you for a lifetime. Secondly, people who have depression that have good cause to believe that it's primarily biologically based, and do be careful about establishing that but let's say that you are reasonably sure of that, you've got good reason for that. Well, people with that biological cause often don't feel the need to undergo this kind of talking therapy. And it's true that if you have a primarily psychologically caused depression, cognitive therapy has a very good shot at helping you achieve remission, whereas with biologically caused depression, that's much less likely. Nonetheless, perhaps surprisingly, in my view, it remains important. Firstly, it can really help you to respond appropriately to your own depressive episodes. You learn how to cope with the challenges that happen much better. Secondly, if you've been depressed for a long time and you've now recovered, in my experience, that process, the depression for all of that time, creates distorted thinking patterns, and these can easily and usually do persist, even after the biological impediment to your mood has been treated. For me, as an example, I had depression at a relatively young age, in my teenage years. I was still forming the way I thought about things, still forming a lot of these thinking patterns, and a lot of those that I then installed during that period ended up being quite faulty and not serving me well. If I hadn't untangled my thinking with cognitive therapy, if I hadn't learned to redo the way that I was doing all of those thinking, then some of those thinking patterns might still be there to this day, and they might be making me less effective in every aspect of my business and personal life, and indeed perhaps more susceptible to a relapse. Indeed, I am so passionate about cognitive therapy that I believe it could be very beneficial to teach it in schools, even to people who are mentally healthy and happy. We don't all learn the very best thinking patterns at school or from our parents. Even if we don't have a mental illness, that can be the case. Cognitive therapy for me is a bit like teaching bottled up common sense. If we could encourage teaching cognitive therapy along with my other favourite psychological intervention of meditation in schools, I think we could greatly help to inoculate the next generation from many forms of mental illness, while helping people get the absolute most out of life, increasing overall happiness and building a deeper sense of contentment in so many people's lives. It's been such a game changer for me. In fact, I believe that at least part of the confidence that I had to find to attempt to do these very challenging videos has probably come, almost certainly has come from doing that cognitive therapy all of those years ago. The premise of this therapy is so simple and it's so obvious when you see it and when you do it, but like all good ideas that are really obvious, you don't necessarily know it until you've seen it and done it. So if you're unsure about it, what I would ask you is, do you think you've got something to lose by trying it? And are you sure that it won't work if you haven't tried it? So there are two main ways to do cognitive therapy: through a book, which is called bibliotherapy, or with a therapist face-to-face. They both have pros and cons, and I've done both. I'll review my favourite cognitive therapy book, bibliotherapy book, The Feeling Good Handbook by David Burns, in another video, and I'll also review in another video face-to-face counselling. I'll also talk a bit more about my personal experiences of cognitive therapy and how profoundly helpful both of those ways of doing it were. Thanks for listening, and see you on the next video.